This video is for Psychology 101, and it is called Psilocybin and its effectiveness against generalized anxiety disorder. In the last few years, psilocybin, the psychotrope found in certain species of mushrooms, has gained widespread media attention due to its substance's potential ability to assist in those enduring through mental illness, particularly depression and generalized anxiety disorder. Established pharmaceutical treatments such as antidepressants and anti-anxiety medications are life-saving for certain individuals. They are nonetheless they nonetheless are ineffective for all demographics of patients and accompanied by undesirable side effects such as sexual inability, worsened anxiety, and more mental health disorders. Some patients spend years experimenting with various medications without discovering one substance to alleviate symptoms. Others suffer through emotional blunting, where pharmacological interventions numb not only the symptoms of sorrow, but even the subject's capacity to feel pleasure. These failures inspire both patients and academics to seek new ways of treatment. Psilocybin in clinical environments has potential to be an effective means of intervention for anxiety and depression. Through a review of current scholarship detailing these mechanisms by which this substance communicates through the brain and assessing corresponding benefits and risks. Academics capable of comprehending the reasons behind psilocybin emerging upon an upcoming challenger to processes for caring for one's mind come to the conclusion that psilocybin is more effective not only because of its neurogenic properties, but its effects on the brain default network. The brain default network being the network for making new connections. So, activity in the brain where there wasn't a whole lot of activity suddenly spikes due to more connections and looser neurogenesis. Research into the therapeutic benefits of psilocybin for treatment of depression has produced surprising promising outcomes. Recently, a meta-analysis conducted by the Journal of BMJ found that people given the journal of given psilocybin showed remarkable improvements in the symptoms of their depression, and these benefits lasted for some weeks or even months. Traditional antidepressants such as Strattera or Zoloft take redosing every 24 hours for the compound effect of the SSRI component or the SSNRI component. Whereas psilocybin, you need to only redose every few weeks or up to a month. The reasons for this is an effect called the afterglow. Afterglow is where the serotonin and dopamine are still high, and the levels of those neurological chemicals are high enough to produce an antidepressant or anti-anxiety effect, such as seen here on the diagram that I'm showing you. You can see that the reuptake of the serotonergic and the dopaminergic compounds stay within the receptor far longer, as well as affecting the glutamate receptors for more connections, longer than the effects of Zoloft or Strattera. Those run through your metabolism far faster, whereas psilocybin, it takes so longer to break down, offering for a better treatment without dosing as often. That being said, it is far better to dose in a clinic, such as ketamine therapy, than it is to dose on your own, as doses are hard to track due to the active metabolites within the psilocybin mushroom. Psilocybin, by dry weight, only has a few milligrams per gram, whereas Zoloft or Strattera is also measured by milligrams, but the compound of psilocybin is stronger. So usually the dose of 2 grams is 15 milligrams, and that effect lasts for 6 to 8 hours. And the afterglow can last up to 2 weeks. This is far better than any other antidepressant on the current market. In other studies, psilocybin was tested alongside more traditional treatments like ketamine or electroconvulsive therapy and showed equal efficiency, particularly where patients' states of depression have resisted other pharmacological treatments. So, such as ketamine, whereas the depression is harder to treat, psilocybin, alongside other therapies, such as even CBT therapy, or electrocompulsive or ketamine therapy alongside it, offer far greater effect and far longer results than traditional antidepressants. This is just one factor of it, which is why I think psilocybin could be a better therapy option than traditional antidepressants. Not only does it last longer and has fewer side effects, but there's almost no lethal or LD50 to psilocybin. That being said, the risk of psychosis for psilocybin does increase for the amount taken, but it is not a permanent psychosis. But the caveat of that is it causes a condition called HPPD, which is where there's so much neurogenesis in the ocular section of the brain where it just creates minor hallucinatory symptoms that last for months to years. These symptoms can be distressing in higher states of the HPPD. But how does psilocybin even work? Psilocybin is metabolized into the system as psilocin. This acts into the brain's serotonin receptors, as you can see upon this diagram, but it also acts upon the dopaminergic effects, as seen upon the diagram, and increasing the brain default network and connections. An effect opening up new lines of communication in the brain. This relieves symptoms of depression because those areas in the brain are more active. So patients often refer to these experiences as being resetted or rebooted. And though this description does not accurately depict what is happening in the brain, it does offer some effectiveness per se in how patients see it. Majority of patients show that psilocybin was far more effective and caused less side effects than their other antidepressants. Up to 60 or 80% of patients report side effects. The long-term brain or body damage has not been reported, but is carefully monitored. However, above does not imply that psilocybin is completely safe, as mentioned before when I was talking about HPPD. This, however, can exacerbate symptoms such as schizophrenia, so psilocybin is not effective for all patients. It is effective, but not for all demographics, especially if you have symptoms of cardiovascular disease, or schizophrenia, or psychosis in family members. You are at risk. This is the reason why modern clinical research insists upon the importance of set and setting. Patients' mindset and physical and social environment in which they take psilocybin brings upon different results. So if your environment, or if you are prone to schizophrenia or psychosis and your family, like you have the genetic factor, psilocybin is not effective. Well, most research is Focused on depression, psilocybin has also shown effectiveness in generalized anxiety disorder. There is marked reductions in anxiety after psilocybin therapy sessions, but it is still more effective in CBT therapies alongside it. And this is my report on why I think and have found research onto why psilocybin is a more effective antidepressant than other current market antidepressants or anti-anxiety meds. Overall, I think that psilocybin shows real promise if we continue research into it. But that's about it, and I'll see you later.